Hey there, welcome to our video on hernia surgery recovery time. If you or someone you know is about to undergo hernia surgery, it's normal to wonder how long it will take to recover. So, in this video, we're going to talk about the typical recovery timeline for hernia surgery. Pre-surgery. Before we dive into the recovery process, let's first talk about what happens before the surgery. Your surgeon will give you detailed instructions on how to prepare for the surgery, including any necessary tests or procedures. It's important to follow these instructions carefully to ensure a smooth recovery. Surgery. Hernia surgery is typically performed as an outpatient procedure, meaning you can go home the same day. During the surgery, your surgeon will repair the hernia by pushing the bulging tissue back into place and strengthening the muscle wall. The type of surgery and your overall health will determine the length of the procedure. Immediately after the surgery, you'll be taken to a recovery area where you'll be monitored closely until you're ready to go home. You may experience some pain and discomfort, and your surgeon will prescribe pain medication to help manage these symptoms. You'll also be given instructions on how to care for the incision site to minimize the risk of infection. First week after surgery. During the first week after surgery, it's important to rest and avoid any strenuous activities that could put stress on the incision site. You may need to take a break from work or other daily activities to allow your body time to heal. It's also important to eat a healthy diet and stay hydrated to promote healing. Weeks 2 to 4 after surgery. As you enter the second and third weeks of recovery, you may start to feel better and be able to resume some light activities. However, it's important to avoid any activities that could put strain on the incision site, such as heavy lifting or vigorous exercise. You may also need to continue taking pain medication as needed. Long-term recovery. Most people can return to their normal activities within 4 to 6 weeks after hernia surgery. However, it's important to continue monitoring the incision site and follow any instructions from your surgeon. You may also need to attend follow-up appointments to ensure proper healing. When to contact your doctor. While most people recover well from hernia surgery, it's important to contact your doctor if you experience any of the following symptoms: severe pain or swelling, fever or chills, redness or drainage from the incision site, difficulty urinating. In conclusion, recovery from hernia surgery typically takes 4 to 6 weeks, although the timeline may vary depending on the individual and the type of surgery performed. By following your surgeon's instructions and taking care of yourself during the recovery process, you can ensure a smooth and successful recovery. Thanks for watching.